It's that time of year again. CMS released their upcoming proposed fee schedule for 2026. In this video, we'll talk about some of the highlights and what you can expect as you plan for 2026. Hi everyone, this is Dan with ThoroughCare. The big highlights that we want to share with all of you today are around remote patient monitoring and remote therapeutic monitoring. As you know, for remote patient monitoring, patients have to get 16 days of readings for each calendar month in order to bill. Well, sometimes it's difficult for patients to get 16 days of readings. So beginning in 2026, CMS has created a new proposal where if at least 2 days of readings occur, you can now bill for the RPM readings code. This new code, whose code number is still to be determined, will allow you to capture between 2 and 15 days of readings, where if your patient still gets 16, you would bill for $99454, just like you usually do today. We're not quite sure what the reimbursement will be for the 2 days of reading codes, but initial indication is that it will be reimbursed at about the same rate as the 16 days of readings code. This is really good news for all of our practices doing RPM. For those of you doing RTM, a similar structure is proposed for this program as well, allowing you to get 2 days of readings for RTM with a similar structure of coding. As you know, RPM and RTM also have a minutes-based code that requires 20 minutes per patient per month. A new proposal is also coming into effect to create a 10-minute version of this code. So if you get 10 to 19 minutes, you could still bill for the minutes code for RPM and RTM. The 20-minute code is still in effect, that won't change, but now you'd have another option if you fail to get 20 minutes with the patient. It's still early and we're not sure how these codes will be finalized, but our initial thought is that these are really good for our providers and partners. We believe that CMS is taking into account that sometimes you might not need as many readings or as much time to still provide valuable care to your patients. Because of that, we think these codes will help you in those scenarios. Now, keep in mind, all of this is just a proposal, and with the release of this on July 14th, there's a 60-day comment period. So we encourage all of you to share your comments with CMS before the September 12th deadline. If this video was helpful, we invite you to please like it, and as always, subscribe to our channel so you can get the latest. Have a great day.